Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about CAS codes and Remark codes. CAS codes can also be referred to as CARC codes, but most people in the medical field who deal with billing will call them CAS codes. Now you're going to say, okay, great, what is a CAS code? And CAS is an acronym for Claim Adjustment Segment. CARC, C-A-R-C, stands for Claim Adjustment Reason Code. And like I said, they're the same exact thing. They're referred to differently by different people, but they are the exact same thing. I did a video on what is an EOB/ERA, and I encourage you to watch that if you don't know what those are, because the CAS code is found on the EOBs/ERAs. Basically, after an insurance receives a claim from a provider, they do an adjudication of each line item that's on there, and each line item is often a different service that was rendered to the patient on the claim. Now, the insurance looks at each individual line and sees what diagnosis codes are associated with it, and then they decide if they're going to pay for it, if it's appropriate, and then if they are, how they're going to pay for it. Does it all go to patient responsibility? Is it split between patient responsibility and the insurance will pay some, or is it denied? These codes will tell you how and why they were paid or not paid. The CAS code is on every line item, and there's always a key at the bottom of the EOB that will mention what each CAS code is. So if it has a CO45 CAS code, I know off the top of my head, that's a contractual adjustment code. And so if you're in network and you have to take a contractual adjustment on the claims at each line item, then you will have a CAS code of CO45. And if you don't know what it means, you go to your little key on the document and it says CO45. It says CO is contractual obligation. You go to 45 and it will say provider contractual adjustment or something like that. So you will just kind of break down, it will CO-45. Okay, look up the CO, look up the 45. If it's a PI, then you look up PI, what does PI stand for, and whatever number is, you look at the number. For patient responsibility, oftentimes it will say PR, patient responsibility. Pretty obvious. So you'll go PR, patient responsibility, 1, oh, that's their deductible. PR2, oh, that's coinsurance. PR3, oh, that's copay. And I might have them mixed up, but you get the point. They are very helpful, and oftentimes you will need to know this to make sure that there's no issues with the way that it was processed and paid for, or going to be paid for, whoever's responsibility is, either for the insurance or the patient. Now, CAS codes are going to be on all the claims, and they're going to be at each line item. The other thing that you can have is what is called a Remark code. A Remark code is oftentimes underneath. So the CAS codes will be on there, and it will have a dollar amount associated with it. So it will say like $25 CO45. Okay, $25 was the contractual adjustment. Okay, I get that. Or $20 PR-3. Okay, $20 PR patient responsibility, 3 is copay. Okay, $20 was patient copay responsibility. It will have an amount associated with those CAS codes. A Remark code will not. A Remark code is usually listed after the CAS codes and underneath that individual line item for anything specific that also needs to be mentioned about that claim and that specific line item. So it's usually a letter and then like a number or two. So M25, N68, and I don't know those off the top of my head, but there's always a key. And so you'll go below the CAS codes on the key and you'll see M25. And the nice thing is they only list the codes that are associated with that specific EOB ERA, not all of them that could be the possibility. So that makes it a lot nicer too, so you're not having to thumb through a lot. Now, if you receive an EOB or ERA from like Blue Cross Blue Shield and you have a lot of patients that you bill to that insurance, you might have more than one patient's claim adjudication on that EOB or ERA, and they're split up into sections. So one Remark code might not be used on 4 of them, but on the 5th one it is. So they will list any that associate with any of the claims at the very end of the document. You want to make sure you're reading these codes, you understand these codes, because they're going to help you troubleshoot if anything gets denied, if you're noticing that things are getting shorted or not, paid all the way you're expecting them to. For sequestrations, which is money that gets taken out of claims for certain programs like MacroMIPS, Medicare type stuff, any kind of take-backs they might be taking from a past patient's claim where you owe them money. They say, we'll just take it back on a future claim. They might, say, we're going to pay you $60 for this patient's claim, but then there's a code associated and it says $30 of this is a take-back, so you actually only get $30. It has a lot of information, so you want to make sure that you're looking at those, or whoever's posting your insurance payments are looking at those closely, and as they're posting and reviewing these ERAs and EOBs, that it's making sense, it's adding up, and if something's like, that's weird, they're doing a little bit more investigation so that it kind of points them in the right way to go outside of the EOB and ERA to maybe fix something or try to bring it to someone else's attention if there's something upstream that needs to be done, like maybe something got denied because there was no referral on file or a prior authorization. Well, if it gives you that code and it tells you that and a line item got, denied or whatever because it was missing, then someone needs to read that and take it to the office manager or whomever is responsible for the staff that needs to be getting those and making sure that, one, they're obtaining those before services are rendered, it's getting put on the claim where it needs to before it gets sent out, etc., etc., etc. CAS codes, Remark codes, super important on EOBs, ERAs. Make sure you understand those. Do a little bit of your own research. I'm just putting it out there because I've done other videos where I have assumed that my viewers know what an EOB or ERA is. So I did a separate video recently on what those are. And now I'm adding to this because I assumed that people knew what CAS codes and Remark codes were on the EOBs, ERAs, and I shouldn't have, so I'm kind of backpedaling a little, but this hopefully will break that down for you, especially if you've never been involved in medical billing or you've never seen an EOB or ERA. Now that you're familiar with at least thinking about it, just Google EOB, ERA, look at the CAS codes, look at the Remark codes, and if you have any questions, comments about this, please do not hesitate to leave that in my comments below. I'm happy to help if I can. If today's video was helpful, please smash the thumbs up button, subscribe to my channel if you haven't already, and please share my video with anybody whom you feel would benefit from this information. Take care of yourselves, and we'll see you next time. Bye-bye.